Well, we've got a little bit of time. I know we're standing between you and lunch, but we're going to take questions till about 10 after, so I want to be able to see the entire room, so I'll stand up here if there's any questions for our great panelists here. Mark?
Well, first, my thanks to all of you. It was very, very helpful and very, very useful work. And it raises a question in my mind about who pays for these studies. It sounds like there aren't enough studies and there aren't enough good studies. And I'm really glad that Phelan still goes forward with making what we do have available. But this question about who pays, I understand when there's a new drug for erectile dysfunction, or there's a new drug for skin blemishes, pharmaceutical companies pay, and they pay very big bucks to have the effectiveness of their drugs studied, quality studies, valid results, randomized controlled trials. They get a lot of money to pay for those. Who pays for these studies? Who's interested? I could see that the same model wouldn't really work because sometimes people who invent the intervention may not want it reviewed, evaluated, or critiqued. But just that question, do you have enough resources to pay for the studies? Who pays, and what's the solution for this?
Well, I think any one of us could probably answer that, but I'll just say that, you know, federal government pays for that through agencies like mine and others, some of which might be an award directly from us, or it's money that goes through states that they might use to support studies, and foundations support studies. There are probably other sources, but I would say that those are the two sources that provide the most support. And I would say that no, we're not making the sufficient kind of adequate kind of investments that we need. I don't think that there's a clear sense for what the research agenda is or should be, and where the gaps are, and how we fill those gaps. I've seen some promising efforts out of education more recently to try to come up with a more systematic way to look at that. But we haven't applied that necessarily to the field of violence prevention or justice more generally.
What implied in your question, Mark, is there might be a problem here, and I think the answer is yes. No one or very few individuals are going to make a lot of money commercially selling violence prevention programs. This is something in the public interest, and the research support has to basically be supported in the public interest, which means taxpayer dollars at some point. And I think we're, if we haven't been before, we certainly are now at a kind of a critical point in terms of the evidence base, if we're truly going to have evidence-based practice widespread. And I would add systematic reviews. Who pays for systematic reviews that tries to pull all this together in an integrated way? It's been a struggle for the organizations that try and do that. And it's a political problem, in my view. It's very frustrating to have politicians get interested in something and call for evidence, and the evidence isn't there, and they haven't bothered to invest in developing it. It's sort of a vicious cycle that doesn't help.
Questions? Elizabeth?
Really very interesting presentations. And one thing I'd like to say is I wonder if you look between the websites, how much concurrence you're going to find, an agreement, and whether somebody'd like to do that. But more on a concern from a lower income country where we have huge problems, you know, trying to, some promising practices, they need evaluation. Recently applied for 1 or 2 calls for proposals. And though they'll give you money for the evaluation, there is no money to ensure the fidelity of the program. And I mean, in other words, you're the evaluator going in and you have small NGOs doing, you know, relevant, cost-effective, looks like very promising studies that could maybe benefit many countries, but you're not able to ensure that you're going to have fidelity over the duration of the evaluation even to see that that program works. And where does that really leave us?
So, excuse me. We did a comparison across lists. And when you get to the higher quality, what's at the top of each list, it gets very consistent. And when you say what's on more than one list, that's pretty consistent. But most of the lists have things that aren't on the other list because of variation criteria. But if you say what are model programs or what are programs that has been the strongest, those seem to be pretty consistent across the list.
Yeah, and just to be a little more explicit, Blueprints has a higher evidence standard than Crime Solutions does. But to Patrick's point, all the Blueprint model programs are also included on Crime Solutions.
Does anybody want to tackle the issue of implementation fidelity and the funding of that? I think that was your question, Elizabeth, was or comment.
Yeah, I mean, I think that for if you're looking at replication of programs that are defined as evidence-based, I think that your best case scenario is I think what Patrick was referring to, where you really have a model program, decades of research, very clear sense for this is exactly how you do it, and under those circumstances, you can really essentially manualize the program and say, if you don't do it like this, if you hire this kind of person instead of that kind of person, then you're just not going to see the kind of results that we are striving for. Where you get into these promising programs, these programs with lower levels of evidence, there tends to be a less manualized approach. It's more, well, we did these general things, and it's not so much that this program works, it's that this program worked, right? It worked when we did it. It's efficacy, not necessarily effectiveness going forward in every effort and under those circumstances, you're trying to implement off of promising efforts like that, well, then you can't be so certain about exactly what are the procedures for implementation that have to be in place in order to get your outcomes. So you're really in the business of building more evidence at that point. And you've got to be putting strong evaluation in place. And if somebody says, well, we've got to do it slightly differently here, then the recommendation would be, very well, please do good evaluation so that we can learn. Is that variation, it might help. It might improve the outcomes of the program.
Well, I think we're going to bring this session to a close. I'd just ask that we thank our excellent panel here. And
it's time for lunch, but we have a really interesting lunchtime program. So what we'd like to ask everybody to do is go outside, and there's box lunches outside. Pick them up and come right back in. And at 1:20, we're going to have a presentation on the results of an app challenge that resulted from an earlier workshop on violence prevention and communication technology. And Carol Kurzig and Nancy Schwartzman are going to share the results of that. So please come back as soon as you can.